Call. Their doctors, nurse practitioners, and physician assistants specialize in caring for people with multiple chronic health conditions. Joining us now is community health advocate Michelle King. Thank you for being here, Michelle.
Great, thanks for having me.
Of course, yeah. So tell us a little bit more about Landmark. You guys are really important, serving a need in our community.
Well, Landmark is a new medical group, and we're focused on caring for complex patients, so patients with multiple chronic conditions. And what we do is we go to the patients and treat them urgently at home, sort of like a urgent care on wheels. And then we'll go to the patient after hospital stays to make sure that they understand their post-discharge instructions and medications. And then we'll visit them routinely to proactively help manage their health and provide education for the patient and their caregivers.
Okay. So what are chronic medical conditions? Can you give us kind of an example of what will qualify?
So when I refer to the chronic patients, those are patients that are dealing with and living with multiple different diseases like diabetes, heart disease, cancers, and lung disease. I'm sorry.
No, that's fine.
And and so it's really just trying to focus on them and keeping them healthy and at home. A lot of times in healthcare today, we just don't have the time to spend speaking with these patients in a typical appointment. And so going to them actually provides them time to sit and speak and get all their questions and their answers taken care of for them.
Sure. And so you guys are like the cheerleaders, really, the support network, an extended part of the family, right? I mean, you get to know these patients, I would assume, kind of like a good friend.
Exactly. That's the whole part of it, is when you enter the home, when our providers enter the home, they get to sit with these patients. They get to sit with them either in the den, wherever it's most comfortable for them, at the kitchen table, and spend a lot of time, sometimes up to an hour. They talk to them about their health conditions, their life goals. They can provide education, and it's not just for them, it's also for their caregivers.
Sure, and I was going to say, this sounds like it takes a lot of pressure off family members too, right?
It does. A lot of times, we find patients, but moreover their caregivers, they focus on, or they rely on the emergency room. They rely on urgent care in times where they may be unsure of what to do.
Sure.
And so when you're a Landmark patient, they can call us at any time. They can call us day or night. We can answer their questions. We can treat them over the phone. We can also go to them urgently, and then we can also confirm if going to the ER is the best option for them. So it's really like a safety net for them, an additional safety net.
And I was going to say, just, how does Landmark help patients avoid the ER? This is kind of a two-pronged question. And then secondly, when do you know you need to go to the emergency room?
So that's really the whole goal, is to keep the patient healthy and at home. A patient that goes to the emergency room that has chronic conditions sometimes results in a hospital stay, possibly a discharge to a nursing home instead of home. It can be a long and costly recovery for the patient. A lot of times it leaves them less well than when they first went in. So when we're there and we can help them proactively, it reduces that need to have to rely on the emergency room to get healthy. So
sure. Okay. And then Landmark is hiring, right?
We absolutely are. We're in need of doctors, providers on the North Shore and on the Gulf Coast of Mississippi. And we're always looking to hire new nurses, clinical staff for our office here in Metairie. So.
Okay. And just reiterate for us, how important is this in-home care? It's great having doctors come to you.
Absolutely. For those patients, sometimes it's hard for them to get out, arrange transportation to get to be seen by their doctor. And again, so having the doctor be able to go to them makes it easier for them. They're able to talk a lot more. They feel at ease because they are at home. So they tend to share a lot more, and that's the whole goal, is to help keeping them, healthy and out of the emergency room.
Sure. And I was going to say, oftentimes I feel just more comfortable at home. You're in your own space, and I don't like hospitals. So, with that scary lighting, it's like, oh my goodness. So it'd be great to have somebody who, knows what my ailments are and who's there to really, help you.
Yes, absolutely. That's what we're here for. And we're so happy to be part of the community and helping out where we can.
Sure. And then tell us, what areas do you serve?
So right now we're currently serving the North Shore and then along the Gulf Coast of Mississippi. So everything from Waveland to Pascagoula, basically. Okay. And there's plans to expand. So, you know, it's a good deal. I ask everybody to go and, you know, talk to their healthcare, talk to their plans, see if we can become a part of their family.
Sure. And so Landmark is expanding, so it's obviously working.
It is working. So around the United States, you know, Landmark has been around for about 5 years, even though we're new to this area. Early information is showing that by having Landmark, we're reducing ER visits by 39%.
Wow.
And overall mortality rates have reduced by 53%. So we're helping our patients to live longer. So that's another benefit.
It is a benefit
of having Landmark.
All right, wonderful. Thank you so much for your time.
Right, well, thank you.
All right, well, to learn more about Landmark Health, you can visit their website, landmarkhealth.org. You can also give them a call at 833-362-5364. Their address, 1 Galleria Boulevard, Suite 1420 in Metairie. Well, there's much more to come on Great Day after the break, so make sure you stick with us.